health and wellness coaching for both my personal and my professional role. I see patients, a variety of different patients. They could be patients that have chronic illness that I'm seeing. They may have specific symptoms that I see them for. They may just have some lifestyle things they want to work on. So I use my coaching skills with a variety of patients. And mostly I think it's really meeting them where they're at in their journey and helping them along the way with that. Kind of being beside them, but a little bit behind them in their journey, and having the luxury to work with their own wisdom for them to come up with what's their next step, where do they want to go on their journey. So it's a very humbling experience for me to be in that place with them. Yeah, I think as a nurse, especially in healthcare today, we have a challenge of spending enough time with patients or with clients. And I find that the coaching model allows me to be in that place with them a little bit more or longer, or in a deeper relationship with them. So I really understand where they're at and what their needs are, what's most important to them. So I'm getting certainly much more satisfaction out of my job, my role as a nurse, and actually connects to what my meaning and purpose of going into nursing was to begin with. That I wanted to be able to help people. I wanted to be able to connect and have that relationship and help them on their journey.
And how is
Personally, and now the skills for coaching go beyond just my patients. It has transformed even my personal relationships at home with my children, not necessarily being in that role of telling them what to do, but being in a relationship with them as well. So recognizing their wisdom and respecting them, valuing them, and having more compassion in that role as well. So I see my relationships at home being even deeper and more meaningful to myself and hopefully to them as well. I'd say the most important components of the coaching program for me was the structure, a little bit of the structure, having some powerful questions to ask, but really the structures of consciousness. Because I felt that was a way for me to bring in some of my skills I already knew as an integrative nurse specialist into my practice, but also have a variety of different tools that I could use to connect with patients in a different way, or create some more awareness for them, or just a different way of thinking as well. So I found that to be very powerful. I have an example would be there was a patient I was with probably a couple weeks back, and she was struggling with a change she wanted to make in her life, and trying to think about it very purposefully, but had a hard time coming up with a solution. So instead of doing the typical, let's keep talking about it, I invited her to stand up and use her body to connect with these different options. So move around the room with the different options she had in her mind and see if there was some more clarity that came with that. And it was very powerful for her. She had different body sensations as she moved to each different option and found one that felt much more comfortable for her. And that was at the end of our session, as we funneled down in our conversation, that was the one thing that she wanted to continue to work with. I mean, physically, she went from standing on 2 feet in one option to just standing on 1 foot. So she felt completely out of balance in that option. So it was very clear for her, just getting into that practice. So using a different tool that people typically wouldn't do has been very powerful in my coaching practice. I have a couple favorite coaching tools that I use. One is just to stop and take a breath. I think that allows people some time to connect to their body. I think it also allows them some time for more clarity of options, and some space to think or just to process. The other tool I use a lot is the options tool. So getting up and looking at the different options, moving around the room and taking a look at those and feeling them in your body. I use that quite often as well. Probably the thing I would add is that I think this is a way for nurses to get back to their true self, and connecting to the true self of our patients as well. So I think this is not a big paradigm shift for us, but probably getting back to where our profession started with from the beginning.